My name is Dr. Alex Kuciejewska and one of the oncology doctors at the Royal Free Hospital in London. So today we're talking about treatment-related symptoms of menopause, which happen to patients after completion of treatment of breast cancer. So today we're making this video because our patients find these symptoms very challenging. Hopefully we can show that with the right strategies, we can manage the symptoms better, improve patients' quality of life, and protect long-term health. Anti-cancer treatment, such as surgery, chemotherapy, radiotherapy, and a group of drugs called endocrine treatment can cause severe menopausal symptoms. These include hot flushes, vaginal and bladder symptoms, sleep disturbances, and mood difficulties, and many others. These treatments can cause menopausal symptoms by reducing the estrogen, the female hormone, in the blood. It can happen either by stopping the function of the ovaries or reducing the production of estrogen in other parts of the body. Whether the patients develop menopause symptoms or not vary, and also the severity of symptoms can vary from one person to another. Menopause caused by anti-cancer treatment happens a lot quicker compared to natural menopause, and that gives the body less time to adjust. The quick change of hormone levels is often the reason why patients have severe symptoms. Whether the women have a second menopause later in life depends on the age they were diagnosed, the treatment they have had, and whether the menopause was temporary or permanent.
There are many symptoms associated with menopause. Some of the most common ones are hot flushes and night sweats, vaginal and urinary symptoms, fatigue and sleep disturbance, mood changes, or joint pains and stiffness. Each person's experience will be different. Treatments for menopause symptoms include non-hormonal medication, changes to your lifestyle, and holistic approaches.
Following cancer treatment, particularly breast cancer treatment, we do not recommend hormone replacement therapy. This is because it increases the risk of the cancer coming back and in the future increasing the risk of another cancer appearing.
You can do the following to help reduce menopause symptoms. Have a healthy, balanced diet, exercise and stay physically active, get adequate sleep, manage stress, use complementary therapies, or reach out to support groups and talking therapies such as cognitive behavioural therapy, CBT. It is helpful to follow a Mediterranean-style diet with plenty of fruits, vegetables, pulses such as beans and lentils, plus nuts and seeds.
The timing of the meals is really important to consider. It's not a good idea to have a big meal late at night because it will disturb your sleep. You should also consider dietary triggers, bringing on hot flushes. Sometimes doing a foods and hot flushes diary can help. The natural menopause is one day in a woman's life when she have not had a period for 1 year. As discussed, the treatment-related menopause happens a lot quicker, sometimes in a matter of weeks or even 1 day in case of surgery. Menopause, both natural and treatment-related, can cause many symptoms in many parts of the body. Today, we'll concentrate on symptoms that patients report the most in clinic.
During menopause, small increases in body temperature will cause sweating to cool the body down. Often, particularly at night, women start shivering soon after when their temperature drops too quickly. Hot flushes and night sweats are caused by a reduction of estrogen. Women report the sensation of a hot flush in many ways, from uncomfortable episodes of sweating on the mild side to episodes of feeling faint or very unwell. The duration and frequency of these episodes also vary, but even the worst hot flushes will eventually pass. For most women, hot flushes get better with time when the body gets used to the lower levels of estrogen. There are some medications that can help with troublesome hot flushes. This is not hormonal replacement therapy, known as HRT. These non-hormonal medicines either affect the part of the brain that controls the temperature or manipulate the chemicals in the blood called neurotransmitters. The most common are serotonin uptake inhibitors, commonly used as antidepressants. There is also a new group of drugs called NK3 inhibitors, which are currently in clinical studies for patients with a history of cancer. Other options include relaxation techniques and cognitive behavioural therapy, CBT, which can all help making hot flushes more tolerable. Without estrogen, the skin and muscles around the vagina can become weaker and more delicate. This can lead to dryness, itching, and pain, especially during sex or when passing urine. Some women also get urinary tract infections more often. These changes can be uncomfortable and may affect how you feel about sex and intimacy. You're not alone in this, and there are treatments and support available to help. Please don't be embarrassed to talk about these symptoms with your doctor or nurse.
There are treatments available for urinary and vaginal symptoms. These include moisturizers and lubricants. Your medical team will advise you which products to use, as some of them may contain estrogen that can be absorbed by the body and may not be suitable for everyone. The medical team will also advise you on other measures, like adequate hydration, pelvic floor physiotherapy that both strengthens and relaxes the muscles of the bladder that hold the urine, and in some cases, counseling and psychological support.
Many women report feeling constantly exhausted during menopause. It may be related to sleep difficulties. Interrupted sleep may be caused by several factors, including night sweats. This is all at a time when restorative sleep is needed the most. Although more research is needed, we know the second part of the night tends to be affected the most in menopause. This can mean waking up in the middle of the night and not being able to get back to sleep.
A lot can be done to support good night's sleep. Collectively, those measures are known as sleep hygiene. You want to start by thinking about your sleeping space. Your room needs to be cool enough, dark enough, and quiet enough. You then want to think about your bedtime routine, starting 2 hours before you go to bed. You want to avoid any stimulating activities like vigorous exercise or watching screens, and concentrate on calming activities like reading, meditation, or listening to music. It's also important to consider resetting your body clock. A regular wake-up and bedtime routine, including the weekends, will help you to do that. You also want to consider viewing a bright light in the morning. I like going for a walk.
Going through menopause can be emotionally tough, especially during or after anti-cancer treatment. Hormone changes can lead to mood swings, anxiety, or low feelings, but these often improve as other menopause symptoms are managed. You're not alone, and talking to someone, whether it's family, friends, a support group, or a healthcare professional, can really help.
Joint pains and stiffness are a common menopausal problem, but also a side effect of some of the medication that we prescribe. It's often difficult to work out the cause, but it's important to report it to medical team, as the medication can be adjusted. We also know that movement and exercise can reduce both joint pain and stiffness, so getting moving can make a huge difference.
I was diagnosed with lobular breast cancer just at the start of the lockdown in March 2020. My treatment was to have a simple mastectomy without reconstruction, and then hormone tablets. My experience of menopause symptoms after I began hormone treatment were mixed. I took 3 different drugs at different times, and sometime on one of the drugs particularly I struggled, I must admit. Other than that, it was okay, it was varied. And one of the things that I learned through my journey, was how important it was for me to support myself in other ways to help me stay on the medication. Some of those hormone drugs are difficult to take, they do have side effects. And I was lucky enough, I was knowledgeable enough, privileged actually, to know enough to know how I could care for myself while I was on them. It's a whole package. You have to self-care. 2 things that I found really helpful in terms of advice when I was going through it. One was talking to my oncologist. I didn't expect her to be as amenable as she was to talking about it. And the other thing that I did through the Maggie Centres is I talked to a GP who is oncology trained and who is a menopause specialist. And that was the thing that really helped me It really empowered me actually. I know it can be a little bit of a cliche, but that part of it helped me make some really smart decisions. The most helpful thing in terms of my own decision making was about my own well-being and about looking after exercise and nutrition and stress management as part of caring for myself. What that meant is that my diet is better than it was. I have more protein, I have more fibre. That I was already active, but I fully, even more, understand that I will be fit and active for the rest of my life. One of the things that I do differently now is my strength training, and I religiously lift weights 3 times a week, and I have done that since diagnosis actually, and I have bigger muscles and I am stronger because of it, and that helps my confidence as much as anything. I don't feel vulnerable like I did. And I actively do things to relax, which I wasn't doing. And that is difficult to do, but I do. I take time for me to relax many times a week. One of the things that has proved most helpful for me is yoga. And another thing, I have this little curious thing called an acupressure mat that's like a tiny bed of nails, and I lie on it. And it is the most supremely relaxing thing I have ever owned. The advice I would have regarding exercise is that just loads is known about how helpful it is after a cancer diagnosis. It doesn't matter what you did before, what we know is that exercise can help with all of the side effects. One way or another, all of the side effects of treatment are a little better, a little eased, if we're able to be active afterwards. For me, it's been about supporting my energy levels, a little bit about weight management, but for me, I've focused on eating well, looking after my gut, looking after lots of fruit and veg and good protein. I'm having to manage stress hormones differently because I'm in menopause. So I'm actively doing things that help me stay calm because my estrogen isn't there anymore to help me stay calm. So I'm doing things for me that help me relax. Allow yourself to look after yourself actually. When you finish treatment, when you finish active treatment, people around you might expect you to suddenly be fine, and they want you to be. They care enough, they want you to be all right. You might not be, but there's loads of help that you can get to not be. It's all right to not be okay. You might be fine, but there's this expectation that we just bounce back, and that takes a bit of doing, that takes a bit of time. My advice to people would be to seek help, places like Maggie's Centres, Macmillan, and from other cancer patients, because they have walked the walk. So if you can build a little tribe around you of people that have already done that, that can really help.
I know that managing menopausal symptoms can feel overwhelming, but the good news is that many symptoms can be eased with the right support. The medical team is on hand to guide you to the right services and come up with the right plan for you. Thank you for watching.